What's up guys, Dr. Aaron McNally here with Revival Performance Physical Therapy, and today I'll be showing you guys a way to stretch your talocrural joint, which is one of your ankle joints here. So with this joint, it's your two malleoli here, your lateral and your medial malleoli. Those kind of make a joint like this, and then your talus right here make a joint that's similar to this. A lot of times when we get tight in our calves or certain ankle ligaments, what happens is this talus will shift forward, and then when you're trying to bend it into dorsiflexion, it gets pinched right there. So what we're gonna do is push this talus back with our hands or with a band as you're moving your ankle into some dorsiflexion in this weight-bearing position. So if you don't have a band, or at a gym, it's easiest to use a band to kind of do this, but if you don't have that, say you're out at a park workout or just don't have access to the band, you can do this with your hand as well. So with my hand in this web space here, or really anything, but I like the web space here, I'm putting my hand right here. My fingers are right below my ankle bones. So my two ankle bones on the side there, they're below that, and I'm pushing this way on this joint right here, the talus. So I'm pushing that way, and then I'm leaning forward, getting that ankle dorsiflexion as far as I can without letting my ankle pronate. So what I don't want to see is you go in here and then just letting that ankle pronate like that. Maintain an arch here in your foot, pushing that down and then shifting forward. Sometimes I even use my other hand to kind of push this forward a little bit too, just so it helps get a little bit more stretch. So you're going there, I'm keeping that arch up, and I'm putting this knee over the outside of my toes, or kind of the middle parts of my toes, but not the inside over here. So my knee's not going this way, it's going a little bit more towards over these toes while I push back like that. So same thing with the band. It's actually a little easier with the band, but you don't always have access to it. You can put this right below those two ankle bones. Now that's taking the place of my hand, getting out enough to where this is getting some posterior pressure. So it's getting that anterior to posterior glide of that talus back as I'm shifting forward, just like this. And then you just kind of work in and out of that, letting that loosen up that ankle and loosen up that calf a little bit, and encouraging the proper alignment and the proper motion of that talocrural joint right there in your ankle joint. So do the prescribed amount and time and have fun.